Okay, good afternoon again. So in the Human Resource for Health Committee, the key focus areas have been largely around two aspects. One is the health workforce migration policy. We've gone through various phases as a country, with particularly looking at HRH as an export product. I think this was largely magnified by the COVID pandemic, where certain parts of the world faced an acute shortage of healthcare workers. So as a result of that, we saw an agreement between our government through the Ministry of Health and other governments on coming up with a human resource exchange framework. But the uptake of that has been pretty fast, perhaps ahead of policy formulation to guide the same. So we are glad to report that we have been engaging with the Ministry of Health to discuss the health workforce migration framework policy, which would guide the country and other stakeholders in developing the strategies and the guidelines for migration of healthcare workers. How this is important to us as participants in the healthcare business is it affects the availability of particularly critical cadres in our operations, and which would also influence how affordable it becomes to retain those kinds of staff and the integrity of the health services that we shall continue to provide. So from a KHF perspective, it's a key discussion point that we will continue putting our head in to ensure that our interests are also protected and that the framework or the policy is actually sustainable. The second part as a focus area has been strengthening HRH capacity. There's been a lot of policy change around education, and that ultimately will have an impact on how many people are available to be employed in our businesses to provide healthcare. So we thought about breaking this down to 6 key pillars: the pre-service aspect, the entry-level graduates, the licensed practitioners, specialists in training, the specialists themselves already in practice, and then non-practicing professionals. I think what I may say on this is that these key pillars have different stakeholders and different implications on the whole value chain for human resource for health, right from pre-entry to exiting from the workforce. And we have players at different levels of that value chain, and there's also opportunity for some of us who are looking to plug into some of these spaces. For example, entry-level graduates, some of our members have asked about how the process or support in being allowed to become training centers for interns. That enables us to create the kind of workers we want for our unique needs, and also release to the market the standard of healthcare workers that we would wish to have as a country. So, and then we've also had some of our partners wish to be training centers for specialists, like we've had, say, Gertrude's Children's Hospital with interest in running fellowships around pediatric specialist trainings. So many other aspects that we can plug into the whole training value chain. So as HRH, what we are calling upon members to do is if you find that there is a certain segment in the value chain of the HRH lifespan, come in and join the committee, and we can actually support you as team leads to run with some of these aspects. All in all, the CBC education system is being implemented in the country. It's slightly different from how we envisioned it, and we must also as a sector be up to date with it and proactively address some of the challenges or opportunities that may come as a result of that. So thank you, and we continue to have further discussions also with the professional associations. We've been supporting the community health workers, we've been supporting the HRIOs and the EMTs to formalize their curricula and also the policy that surrounds their practice. Asante.